If your child spends hours on screens every day, there's a good chance technology neck is already developing, and most families don't even realize it until headaches, tightness, or changes in posture start to show up. What we're seeing more and more in the clinic is that these early shifts in a young spine often begin silently. Kids don't usually complain because for them, this posture becomes their normal. In today's video, I'm going to take you through what technology neck actually looks like on X-ray. You'll see how a small forward head shift starts, how it progresses over time, and why those changes matter for both the spine and the spinal cord. I'll explain what we look for clinically, what X-rays can and cannot tell us, and how we determine when simple posture coaching is enough versus when more advanced corrective work is needed. Then Dr. Heinrich's going to jump in. He's going to demonstrate the practical side. He'll walk you through the everyday habits that can make a real difference. Simple corrections, like bringing the phone up, supporting the elbows, and using the Titanic posture reset. He'll also demonstrate the Stroop band. We work with that in the office to strengthen the deep, stabilizing muscles of the neck. And for cases that show more advanced findings, you'll get a look at the types of traction and mirror image corrective methods we use here in the clinic to help restore healthier movement and alignment. Our goal with this video is to help you understand what's actually happening inside the spine, what you can start doing at home, and when it might be helpful to get things checked professionally. Let's get started. What we want to show you is the different grades that we see with technology neck or tech neck. So you can see here, the side view here on this X-ray is actually pretty good up until the top. So this is where kids start to get formed into that abnormal posture because their technology's down here and we need it to be up here. So this would be what we call like a grade 1. So not great, but definitely a situation where we want to start to intervene sooner than later. And the age of this child, we're looking at a 10-year-old versus once they get into 13, 14, 15. I'm going to show you next an X-ray that's actually more of a grade 3, grade 4 technology neck, and that's where it gets super, super critical. This is a full-fledged technology neck and super complicated because it's actually got a reversal in the lower part of the neck. So this is something that needs a much more advanced, much more involved care plan, but we can still bring that back. My concern with this student, so we're looking at 14, 15, 16-year-olds, that's kind of the age range we're looking at here. Once they hit university, if they're going off to post-secondary, that's when it really starts to fail forward. So the abnormal biomechanics will start to cause that neck pain, the shoulder tension, even headaches. So by the time this person hits about 30, they're actually seeing degeneration happening in their spine that we normally, if we go back 20 years, wouldn't have seen in a 60 or a 65-year-old. So this is one of the tables that are specifically for the chiropractic biophysics world. So what it allows us to do is to put our clients into their mirror image. So in the case of technology neck, where we have that forward drifted and anterior rolling of the shoulder, so the skull's forward and the shoulders are rolling forward and they're getting this hump, what we do is we have our clients, or in this case, our teenagers, they're actually on their stomach and we're pulling their head back. We're getting that retraction happening before we adjust. Then we'll use a device like this. It's an impulse adjusting instrument, and that oscillates at the same frequency that the mechanoreceptors, so those are special nerves in the spine, respond to as far as postural orientation. So how you know where your body is in space gets stimulated, and if we can do that in a mirror image positioning, then when you get up off that table, the brain remembers and you're more likely to get back into that more upright, correct posture. So this is one of our traction tables that would use for the more advanced technology necks, so the grade 3s, the grade 4s, like that one X-ray that I showed you where we had that reversal. So in this situation, we would actually have our teenager laying down on their back. We would place this around their neck based on their X-ray in the right place. So we would pull and put them in this position, and we're actually causing a traction force to the neck while they're laying on their back. So that helps restore that curve. The research shows that if we can hold somebody in that position for at least 20 minutes, so that's how long we have them in traction, they're actually changing the ligaments and the structures. We call them holding elements. So the ligaments are changing and we get that curve correction after they get adjusted.
One of the things that can hinder the progress we get in office is actually what you do out of office. The most common thing that we see people is with their phones. When you're constantly looking down all the time, over time it stretches the back, those neck muscles get really tight, and over time it can actually recreate the neck curve, the optimal neck curve that you want. The best way to combat this is to bring your phone more to eye level. Now there's a few ways that you can do this. When you're sitting, you can cross your arms and keep your phone at eye level. You can also lean more forward with your elbows on your knees to keep your back straight so that when you're looking at your phone, you're not looking down with your neck, but your back is straight. You can also put your elbows on top of a desk to keep your phone more at eye level. All right, so this is one of the exercises that we do in office to help retrain the neck curve. This is what's called a Stroop. Now this exercise has 3 parts to it, all right? When you just do the normal chin tucks, it can actually make the curve in your neck worse, which is why we have the Stroop to help pull it back into a better position. So the 3 parts for this: without the Stroop, you push your nose as far forward as you can, you look up as far as you can, and then you translate that head backwards, right? Now for some that can feel pretty intense and there's a crunching feeling at the back there, which is where the Stroop comes in, right? So with this here, what we first do is we bring the hands out to the side here, just because it's easier than just straight pushing forward. So what we do is the hands go out to the side here. We're gonna push our nose forward as far as we can, look up as high as we can, and then as we bring our neck back, we're gonna bring our hands forward just like this. And we're gonna hold it, because over time, it'll help to strengthen the neck musculature as well as rebuild that neck curve. And in the beginning, we can start anywhere between 5 sets of 10-second holds, and we work up to, holding up even upwards to 5 minutes. Now, one of our favorite exercises to retrain that posture and really help open up your posture is called the Titanic exercise. This is great for people who sit all day or have a forward head posture and a bit of a arch in their mid-back. How we do the Titanic is we take one of our spinal orthotics and we'll show you where to place it. We place it on the wall where that arch is in the mid-back. Now one of the things that we're going to do, we're going to get in a bent leg stance here. We put our arms out front. Now as we bring our arms back here, we're also going to bring our head back and our pelvis back as well to really open up that pelvis, to open up that posture. We're gonna hold it here, we're going to contract all the musculature, then we're gonna come back and we'll do a few reps just like that.
If you're noticing your child spending long hours on phones or laptops, or if you're already seeing that forward head posture developing, this is the perfect time to get it measured. A simple posture and curve check helps us see what grade of tech neck may be present and build a plan that actually matches their findings. If you'd like our team to take a look, reach out and book a posture check. We're here to guide you step by step. Thanks for watching, and we hope these tips help your family build healthy habits that last.